Hi guys, good evening. This is Dr. Jenny Yusuf, physical therapist and doctor of physical therapy. If you are in US, good evening. But if you are in Philippines, magandang umaga at good morning. In different places in Middle East, salam alaikum and welcome everyone. Thank you so much for listening with us. And also for tonight, we have Thursday. Thanks God it's Thursday. Every Thursday, we highlight innovators, scientists, physical therapists, academicians. For tonight, we have a designer in the house. So, Rocky Storm is the co-founder of Prairie Wear. And then it's my opportunity, and I'm so blessed to meet him and grateful, of course. During the lymphedema month, during 2 years ago, I believe, I met him at some point. So this is an amazing opportunity to learn more because lymphedema month is coming again soon, right? So I would like to share with you what is Prairie Wear and how can it help us. So if you know somebody who had mastectomy or breast cancer, so it's very challenging. So these are really good additional knowledge to know about this, or anybody who are learning post-op surgeries, improving the posture. So let us see and get to know more about it. And without further ado, we have Rocky Storm, the co-founder. Welcome, Rocky.
Oh, thank you so much, Jennifer. It's lovely to be with you.
My pleasure, my pleasure. So for tonight, Rocky, just want to ask some questions about your journey that you would like to share with us. And it's my opportunity to learn more about you. And thank you so much for joining us. I believe you're from Oregon. So what's the weather there right now?
Oh, we got a little bit of sun today, which was really nice because we don't get much sun in the winter.
So it's always cold, huh?
Well, it's rainy. It likes to
Ah,
rain.
okay.
Summers are glorious.
Oh,
So,
okay, because I always hear like I feel that it's always cold, Oregon. Is it like lots of mountains there? Like, is it?
yes, gorgeous
Awesome.
mountains too. Like, the volcanoes, the ones that we draw as children. That's what the mountains look
Ah,
like,
I
right?
love. I know how to draw
So,
mountains, and then my tree is always like that. I didn't change.
perfect.
Yes. So, Rocky, tell us more about Prairie Wear. How's the passion and where the name come from?
Okay, great. Um, So we got together seeing that women had a great need, especially post surgical, because with the technology advancing, the surgeons were able to do both a reconstruction on the breast at the same time as removing cancer or doing a breast lift.
Yeah.
And so, as the women came out with the breast mound, what we were seeing is an increase in seromal formations, that swelling that can happen in the underarm area, especially. And the surgeons were asking us, can you build us something that has much better compression here, right? Not just here, and something that doesn't cut off the circulation.
Mhm.
So that's when we started to design our Prairie Wear line. And what we realized right away was a really simple fact: humans are not symmetrical. We are Everybody is not symmetrical, right? And then when you take that and you translate that into bras, that means that half the bra isn't fitting a woman. And so we thought, what could we do that could address that? And then with all design, it's how broad how many people can you serve with that one design? How broad can that design be? So we came upon seamless, zoned, and mapped compression. And we can fit as much as 5 times the size of swelling on one side, and yet still on the flat side completely compress and give good compression to that flat side too. Really, really important. And so then our regular bras become incredibly comfortable because they do accommodate our natural asymmetry.
That's really interesting because I myself just want to share my story as well. I was in college and I had a small cyst and they need to remove it. So it's a fibroadenoma, but after 3 years, because it's in our genes, then after 3 years again, they remove it again. So it's a cyst. So I have. So with just simple cyst removal, the lymphatic system, and I'm also a certified lymphedema therapist. That's why I'm really interested to learn more about your products, because I met some people in my journey, and I have some me myself. So when I really noticed that once you had a change in your lymphatic circulation, even it is only the cysts or the nodules, I like when you say that you want to balance the zone, of the compression, because that will really very important. So when I met you, I was able to try this. So that's why I really see the difference of the compression, because I regularly just use those like small liner, right? And then the bra.
Yeah.
Uh-huh. It's not really wide coverage, and that's the problem for us ladies, because we have different sizes, and there's like a box. Sometimes you have a nice gown, you will see your fats in the corner, and then some of them they want like there's a nice lace, but there is still always a bump and somewhere that you don't want. So it can be fashionable, not only because you want, but it's good that it's science, post-op surgery, it's healing, there's some medical reason to wear. So that's really good. I tried it myself, so that's why I want to share it with our followers. It's really help for the truncal edema or lymphedema, something. So thank you so much. So I like those sizes when you said that these are really for different size, different shapes. So how different it is from the things that we see outside with the style.
Well, majorly different. So no one had done what we had done before us. So what, because, and again, it's this whole different approach. Instead of making the woman fit the bra, it's make the bra fit the woman, right? And it's not with today's technology, we can do that. And another thing, you know how you were saying that sometimes you put on that fashion bra and it makes you lumpy and bumpy. Well, what's happening there is that you have a different expansion and contraction rate. Your body heats it up, and it opens up the thin part of the fabric, or what we call the yardage goods. It makes that expand greater than the seams. Now, if you do that with somebody who has lymphedema, then you're allowing that lymph to pool. You're making that lymph stay in one area so that the body can't deal with it everywhere. So all those little tight places, that's what happens with them. Our approach is to make everything fit kind of like a second skin. And that's why we use that zoned and mapped compression. The other thing is we're temperature stable at human operating temperature. So our garments don't make you lumpy and bumpy. You're going to look as smooth from the moment you put it on to the moment you take it off, right? And that, again, it's just the basic science of fabric and yarn and your choices of yarn. And then beyond that, it's really, really important that it's completely safe, that we know it's safe to be worn against your skin, because our skin's our largest organ and it does most of the absorbing, right? And so we have to have something really safe against the skin. That's the other thing that we do. We even use a special laboratory, the Hohenstein Institute, and it gives us an Okotex standard 100 certification, and we're level 1 and level 2. That's so safe babies can teeth on the garments.
Wow, that's really good, because when you're elaborating the word safety, is it like some cases that a bra can be allergic for some other people?
Oh yeah, like most people are pretty aware of in California, they found some very harmful chemicals that had been mixed into the socks, right? And so
Okay,
they're
no.
beginning to pass legislation about that. Well, this is why we use a company or a laboratory like the Hohenstein Institute to make sure that everything is completely safe. We
Mm.
when we started, and we have the most amazing CEO, Holly Markwald, and Holly was like, we will not make people in another place ill to make people here better
Oh, that's
everywhere
good.
we are. So they even test our factories and our dyes, and even the water, the rinses used in our garments. And that just makes us feel so much better, not just for the patient, but for the people who are working to make these beautiful garments, right? To
Yes,
working
yes.
so hard. Super, super important to us.
Yeah, I like the compression of it because I can see when I buy, I have different bras before because I stopped since I have those surgeries, I stopped wearing the bra with a what do you
With
call
the
that? The
underwire.
wire.
Yeah,
I was in college, that's what I keep wearing, all those push-up bra.
yeah,
And then since I have keep back with my cyst, and then I said, oh no, I cannot wear this anymore. And then sometimes you will stuck with that, right? So
yeah,
now I have this before I learn about Prairie Wear. I have this normal bra, but there's no compression. It's silky, and then they just make it. So it's not really the goal is to compress and improve the circulation. I
yeah.
think maybe their goal is just to make it even and remove those lining, something like that, just to balance. But I like the compression of it. It's you can really feel. And why did you make it the zipper in the front? What's the rationale for that? But I have
Oh,
an idea.
that's a great question.
Yeah,
Let me
because
show you.
majority of that is in the front.
Let me show this so that your followers can see this.
Thank
We
you.
use not only do we have a zipper, but the zipper pull even locks into place. You can hear it snap if I do it right. And what that does is when the person starts to exercise, move around the house or whatever, it's not going to flop against the chest or make that little bump under your t-shirt or something. And then the zipper's auto lock, so it doesn't matter the position of the pull. It means that you can never spill out, so it's safe, right?
Mhm.
And it's not going to unzip itself. And the
Mhm.
reason we made this front zip was when we put out our questionnaires, one of the most important things, and this came through almost every single to a person patient, said, I want to be able to get dressed and undressed without having my family member help me.
Gotcha.
Right. And it's such a simple thing to keep our dignity. So with that, we said, well, we'll make it zip. And then we'll put a starter hook, a little center breast mass
Yes, yes,
starter
I
hook,
see that.
and a starter hook at the bottom so that it's really easy to, even if you're immediately post-surgical, to kind of breathe through that pain, get the first hook hooked up. Or maybe your hands are hurting that day, right? Or you have a little neuropathy or something, but you can get the bottom hook, then the middle hook, then start the zipper and get it zipped up. That's why we went to that front zip, just because of ease of access. The other thing that it gives us, and I can go, if I get too technical, Jenny, you just have to say, Waraki, don't get too technical, because I obviously love this stuff, right? We need to keep this really good compression back here with no seams.
Yes.
This area, the median or the medial line of the body, that's the place that is the best place to put your fastener, because that circulation is, our bodies are kind of split, as you know very well, and even better than I do. That's probably the best place that we can put it. One
Mhm.
of the other things that we've done, I like that you mentioned that underwire bra,
Yeah.
because what we have done, knowing that women many times, if they've lost, let's say they've had reconstructive surgery, but they've not had they've not had a nipple sparing mastectomy.
Okay.
So that means that they will have lost the feeling, much of the feeling and sensitivity at the breast. So if they wear an underwire, it can actually poke into them and they wouldn't know it until they look down.
No. Okay.
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 Very dangerous. So what we've done with our Hugger Vita, by the way, the first one I showed you, that's our Prima, the number one.
Yes, I like the color.
With this one, if you can see, you can kind of see it on the camera, but we're using now our zoned and mapped compression to create underwire lift and underwire separation with no wire. And of course, all of our bras are pocketed. So if there's a woman and she's had surgery and she chooses not to be reconstructed, she can wear her breast form, but she doesn't have to, right? That's the other thing about, like, for our Prima, the low anchor point, she's not required to wear the breast form. So maybe she's around the house and she doesn't feel like she wants to do that. She can still have good coverage, good compression with no breast form.
It's really nice. So when we say post-op surgery, I know majority are like mastectomy, but how about the reconstructive surgery you just said? What kind of reconstructive surgery? Is it like after the mastectomy and they have the prosthetic? or
Yes.
prosthesis?
So,
Okay, that's reconstructive.
well, they can, there's a whole series. That's a whole series of stuff. And you know what? I can even recommend a surgeon to come and talk to your
Oh,
follow-up
yeah, yeah. I
about
want to
this.
learn more. Yeah, we have
Who
one
would,
here, but it's more
yeah,
vascular. Mm-hmm.
yeah, they'd be so much better than me at talking about this. But basically, you can choose to just to remove the breast tissue completely. Okay.
Mm-hmm.
You can choose to have what's called a nipple sparing mastectomy, where they
Mm-hmm.
maintain the nipple, the pedicle of the nipple, and they maintain sensitivity in the
Yes.
nipple. Okay.
Yes. Yeah.
And then there are non-nipple sparing mastectomies, right? Where the nipple, they don't care, or perhaps they choose not to reconstruct the nipple. Maybe there's cancer in ductal cancer involved. So I don't want to get too technical about this. Plus, I'm a designer.
Yeah, but I think they understood because they know somebody or themselves watching this, that's what they have or their
Yeah.
family has. Yeah, I
Yes.
think we got it. Yeah. Mm-hmm.
And then there's the lumpectomies, right? Where they, like you
Yes.
had, where they
Yeah,
just
I
take
think
one
that's
little
mine.
area.
Mm-hmm.
Yeah.
The
Those
scissors.
lumpectomies. And then there's the biggest of the, well, I don't know if it's the biggest, but the major surgery where the patient has lost skin viability. Okay, so maybe the cancer has gone through the skin, and it's not just for cancer, right? We are talking about procedures now, but they might take maybe some of the skin from the back and fold it up here so they can maintain the blood flow and then
Mhm.
place it on the breast to reconstruct part of the breast. That's again one of the reasons that the Prima has that full back.
That's
The
nice.
other thing about our garments is they're completely dual layered. So you can put, the chip packs that you had to use beforehand, you can put those inside of our garment. And because we're moisture wicking and we're bacteriostatic, you can't make them stink. Seriously, they don't stink.
Oh,
They won't,
yeah, that's
they'll
very
never smell.
important. Mm-hmm.
Yeah.
Because you can wear it 24/7. You don't want it bacteria something, you know.
Yeah,
And
exactly.
they're
Right.
very athletic. You can wear it like a sports bra. So that's very important. You, as a ladies, and they want to be active, post-op or not, normal daily wear doesn't need to be like you had a cancer or surgery. You can wear this as a normal. So that's really good. And with the fashion right now, we have lots of active wear, you know?
Exactly.
Yeah.
Right. We have all the activewear. And let me show you our newest bra. This is the Hugger Luma. And it is really built for that exercise. And this is in our new color, fawn color. Now, again, it's that front zipper, but the neckline is much lower. So it can be worn with more shirts, right?
Okay. Mm-hmm.
But what's really cool about it, I think,
Ah,
is
the back.
this allows you to dynamically adjust it according to your activity level. So
Mm-hmm.
let's say that you're going to go running. You can just crank it all the way up. So it really holds the breasts in place. And
Nice.
because we are taking a different approach, instead of like most sports bras, they're trying to reduce the leverage of the breast by pressing the breast against the rib cage. We're doing this, not this. So when we do this, when the breast tries to move in its oblate motion, we act as a shock absorber. So it
Okay.
works as a sports bra without having to smash the breast into that uniboob problem.
Yeah,
But
that's
again,
really
back to
nice.
here, you're going to run, you tighten it up, but on the way home, you want to buy some groceries because remember, it's never going to stink and it's going to wick all the sweat away from you. You can loosen it up, right? And go and do your shopping, do whatever. You don't have
Yes.
to.
Yes. I will not be surprised that I will meet some in Walmart wearing just like that. Yeah, especially the magenta. I met in one of our department store here. They just wear like that and then a short because that's how they're comfortable and it's an active wear. But in my
Yes.
culture, it's just not comfortable for me just to go out. But that's really how they wear, you know. I just saw a majority of them, especially that bright color. It will be
Yeah.
like a normal, but this skin tone will be really like an inner. I
Yeah.
think I can see more of the black and the magenta will be more on. What color is it? I know it's not. Is it what? No, the magenta pink. I keep calling it magenta pink, but I don't know what's the
I,
color.
I think that's a lovely thing to call it. We call all of our bras after a color that is found on the prairie. Okay?
Hmm.
Because we want people, the prairie is such a quiet and a good place. And when you stand on the prairie, the mountains look like breasts, right? So,
Ah,
right. So we
okay.
call them always, we name them after something on the prairie. So that's our prairie rose pink.
Rose pink.
Wait a second.
Okay.
Not either. You're going to have to edit this.
I don't know how to edit. We can just correct it now. So rose pink, you will search it now as a color. I know the
Yeah.
skin tone neutral. That's only how I call it.
And
Skin
so we have a
tone.
sky blue.
Ah,
We
yeah.
have,
I never
right?
knew that.
We have the wheat beige, which is the one that I was holding up here,
Okay, it's lighter than the tan. Mm-hmm.
and the fawn color.
Oh.
And then, and as I said, that blue, and I don't have a sample of the pretty blue to show you.
I didn't know you have a blue. That's nice. And then the black is the one behind you, the models. All right. That's really
That's
nice.
right. I can show you that really well here too. This is pretty interesting because now you see the difference between the height, the difference between our Prima and the wheat beige
Okay.
and the no moon black. So we call this no moon black. Everything's up to the
Okay.
prairie,
All right.
right?
Mm-hmm.
And then you can, because all of our bras, the shoulder straps are removable or unhookable. So you can configure this as a crossback. So it can be worn with more t-shirts and stuff like that. But that will also increase this compression in here. So if you have skin surging or anything like that, you're doing lots of yoga, that works really, really
Yeah.
well to
That's
help that.
really good. So you have different designs, different styles. So if they want to collect one of each, is insurance cover this? Like,
Oh, yes. And
this is
this
a
is
medical wear, compression garments.
Yep, this is really exciting because I don't know if you've talked to your followers about this, but the Lymphedema Treatment Act, not only it was passed and has now gone into effect on January 1, okay? And now, and this is, I'm not an insurance expert, but from what I
Mm.
understand, you can now get 3 bras twice a year covered under the
Okay.
Lymphedema Treatment Act, okay? So
Nice.
it's really going to help people, and it's going to help those surgeons get their patients in the right things too, right?
Nice,
But I
nice.
like what you said earlier, Jennifer, when these bras are, all of the women in our company wear these bras every day.
Yeah.
And right, it's because they're comfortable and they
Yes.
promote circulation. So
Mm-hmm.
they're comfortable enough that you don't feel like when you get home, you got to rip that bra off. The first thing that you want to do is get out of the bra, right?
Mm-hmm. Mm-hmm.
Which is very important. If it was comfort helps us get better, and
Yeah.
good compression should feel like a hug. And that's why we also call them huggers.
Yes, the
Entire
huggers.
line,
Yeah, I
right?
see
Are
that.
huggers.
Mm-hmm. Yeah, I like it because I want to know, we as a physical therapist, we have this already when they have the problem, right? But we also are wellness experts. So this is a prevention. So you don't really need to be post-cancer, post-op surgery just to wear something like this. So you are more on the prevention. So
Yeah.
I like it to see that way. And then I really invited you because of when you say about the benefits, and then I would like to share it because you talk about it also for especially for our aging and older adults to improve the posture, especially for our osteoporotic patients or something like that. How does it works? So can you tell us more about it?
Well, again, that zoned and mapped compression is going to make you aware of how you stand, right? And
Mhm.
this what this we started observing this. Like even my mother's 87. She'll turn 88 this year. And when she walks in the room, I can tell if she's wearing one of my bras or not, simply because of
That's
the way she
nice.
stands. And it's not that it pulls her back. I just think it makes you more aware of your posture so that you naturally stand a little more opened up. I'm
Mm.
not positive about what is creating that effect, but it's definitely not stresses, right? So let's say that here, for example, if you do lean over in it, it's not going to leave red marks. We don't
Okay.
leave red
Okay.
marks.
Mhm.
Okay, so it's not going to leave red marks. It can leave a compression mark in a very swollen area of the body, like post surgically, but it's never going to leave a red mark. We don't leave red marks. works.
That's nice. Yeah, I feel like the compression part, because I met also some physical therapists, they have this balance vest. So there's specific part on that that they need to put a certain weight just to make you or decrease the tone and the motion or something like that, improve balance. That's why when you say zoning the compression, I think that's really the rationale on that, why the posture is
Mhm.
making. Because when somebody, the nurses, honestly, I'm not a therapist before. I don't have a big breast, and I have a friend that has a bigger breast than me. And she is like shy, like
Yes, yeah.
they are conscious in the class, and then the taller you are, the more fuller breast you have, they're very conscious on their posture. So now I keep telling them just be more upright, and then I think the better position they have, and then I keep asking them, where some nurses asking me how to improve posture, I keep saying just wear a knapsack and then put a book at the back, and that's pulling you back. And exactly how it's been designed is more
Mhm.
on the compression pull, especially the one you have at the back to tighten it more. It's just like that. If you can, they can see a posture brace, they will see the different points. And I think that helps to make it that way.
Mm,
So yeah, when
that
you
makes
yeah, when you say the zone, I think that's really pushing it there, and then just like a feedback in the body that makes it that way.
mm,
So I think that helps. So good to know. So I like it that way.
absolutely. Another reason that we made all of our garments with two layers is for those larger breasted gals that are having radiation treatment, because
Oh,
that feels like such a terrible sunburn, right? It's like being horribly sunburned. And
okay.
if anything chafes against you, it's just agony, painful, right? As we
Okay.
all know, a
I
sunburn.
heard something.
So when you wear our bras, the interior layer is going to stay with the skin, moves with, like, stays as one with the skin. The outer layer takes the stresses. And I think that might also be a part that helps the posture, is that internal layer is sticking with you, and when you feel, you can maybe you're getting some biofeedback that is helping you
Mm-hmm.
from the outside moving differently than the inside, right?
Yeah, that's the term too, the biofeedback. That's why the posture itself and the compression. So
Right.
that's really good to know. So see, we can really say that it doesn't need for you to have a surgery. You yourself, as a family, you can wear it for posture improvement, improving your self wellness, and then your day to day. Yeah, so I think how long they can wear it in one day. Like, is it 24/7? How does
Oh
it
yeah.
work? Mhm.
We've built this to be worn 24/7 in the most uncomfortable time too, right? So if it can be comfortable when you're post-surgical,
Okay.
because it
Yes.
has to be worn day and night, right?
Okay.
Then
Yeah.
it can be. Then we know it can be comfortable from the day for your day-to-day use. It's
Mhm.
actually designed, that Prima's designed to be worn 24 hours, 7 days a week. You don't need to wash it even for a full 7 days. We recommend it's only washed, and by the way, machine wash, machine dry, because of that temperature stability, right?
Okay.
The, it can even be dried in the dryer. There's no problem with it.
That's
Uh,
nice. Mm-hmm.
yeah, and they're very durable. And again, one of the things that's important to us is they don't break off all the small fibers that happens
Mm-hmm.
usually in laundry, because it's a continuous knit, right? So it's just basically one continuous piece of yarn that
Wow.
creates the garment. So they're not breaking up in the laundry and polluting our waterways.
Mm-hmm. I really like the fact that it is really wide, because I am a keloid former, and one of my surgery, when they do some testing, because I need to keep regularly test, if
Mm-hmm.
I will have another growth or something like that, because I'm at risk. So one of my procedure, it cost me a big keloid. And then now, because I wear that, and then it flattens that part. So on top of my on top of my hydrocolloid, on top of the cream. So it balance it more because the more flatter you wear, it's improve the pressure. So
Yes.
always the compression, the pressure is the effective for any scarring on top of those massage and everything. So that's really good. It make it like I like the term when I read that, the truncal edema. I just know edema and lymphedema, but the one that I see on myself is the truncal edema. So that's really good to know too. So thank you so much, Rocky. Do you have any like advice for our listeners, for them who are listening right now?
Yeah. You had asked me such a wonderful question earlier today, and
Mhm.
about how about any tips that I would have
Yes.
like that.
Mm-hmm.
And I want to say that having learned and studied so much, about lymphedema and our circulatory system and everything,
Yes.
any movement is good. Any movement.
Yeah.
It's like, even there was a study, and I wish I could find it. I read this years ago, that the reason that our grandparents used to rock in the rocking chair when they were
Uh-huh.
really old, it actually was moving their lymphatics. And though they couldn't easily walk around, they could move their lymphatics, because, as you know, and perhaps your followers don't, the lymphatic system is powered by our movement. So any little movement that we can do, even if it's shaking your leg, standing on one foot, being like goofy like me, and moving around too much when you talk, it's really good for you. It's actually moving the lymphatics for you. And we now know that lymphatics, that the lymph is even in the brain and is
Mhm.
flushing the plaques out of our brain. It is super important. That's why when we take that really lovely walk after supper and then we go to bed, we find ourselves sleeping most of the night in the same position. And when we don't do that, we toss and we turn. And we're tossing and turning because our body's saying, we've got to move some of this lymphatic fluid. And
Oh,
when we wake up and we're swollen, that's our lymphatics swelling us up, lymphedema, right?
yes, yes.
So,
Mhm.
right. And then as gravity pulls it down, we start to look like we know ourselves to look. We don't look so puffy. So the tip would be move. Any movement is good. It doesn't matter
Yes.
how much of it. Don't make it's not exercise. It's extra fun. It's just moving around.
Mhm. Yes, I like that. Movement is medicine, exercise is medicine. Yeah, so thank you so much. That's really good. I like it when you told me about that movement and fun. We even have in Philippines, we have those rocking chair for our elders. I know what you're talking about.
Yeah.
Those wooden chair. So when you remind me about why we have that, and then I play with that when I was young. And then when you make it too big, okay, good luck to you. When it's too much. Yeah, I know. And sometimes we keep doing and somebody step on at the back.
Yeah.
It means that somebody behind you. And then when they let go of goo, they just want to make fun of you. So I remember that rocking chair. So
Sounds like
I'm
you
just,
had
mhm.
siblings, right? Did you?
Yeah. I have two soon, but the one who will do that to your majority your cousins. Yeah. All right. Thank you so much, Rocky. Appreciate
Such
that.
a
So how
pleasure.
can we connect with you?
Oh, so easy. Our website is prairiewear, okay, .com. Easy to go to. All you need to do if you want to reach out to us is you can go to the website and talk to us right on the website. You can call us at 888-746-7360. You can email us at yoursupport@prairiewear.com, right?
Yes, thank you. I will write all those in a caption. That way it's easy for them to remember. And
Right.
then also Rocky has been highlighted in our balance and fall support group on the bottom on how we can connect with you is also there. So thank you so much, Rocky, and also to your team. And we appreciate you guys. Thank you for helping us, ladies. And of course, I know this is not really for men, of course, right? But definitely not only ladies can have a cancer or breast cancer. So breast cancer awareness month is coming up, and also lymphedema month is coming up. So I hope you can share this to your colleagues or whoever, family members, friends who's listening, or who you think has some issues that might be of help. You yourself, you don't need to have this as what we're talking about, wellness prevention, all right? Athletes wear, athletics wear, something like that. So thank you, Rocky. Thank you guys for watching and listening. Share and then connect with us if you have any question. So it's me again, Dr. Jenny, physical therapist and board certified geriatric clinical specialist, and the recent state advocate for Delaware. I'm in Delaware. So if you have any connection questions, and connect with me with the Physiogen PT and Wellness and the Balance and Fall support group. Bye for now, guys. Thank you. Thank you, Rocky. Bye to
Thank you.
Cuatro. He's so behave, ah. He's not here.
Yeah, he's a good boy.
Okay. Thank